Call the meeting to order.
I'll make a motion to approve minutes for the previous meeting.
I'll second that motion.
Motion's been made and seconded to approve minutes from previous meeting. All in favor, say aye.
Aye.
Aye. All ayes, motion carries. Any additions or corrections to the agenda?
No.
I'll move to approve the agenda as presented.
I'll second that motion.
Motion's been made and seconded to approve agenda. All in favor, say aye.
Aye.
Aye. All ayes, motion carries.
Take a minute to look at the clothes. I talked to Jackie Duffy this morning, and she said that they continue to be really busy over there.
Is there any activity in public health with this Ebola
Yeah, they're having a statewide
meeting, or I'm trying to figure out how they were going to...
statewide phone calls on every Monday, and they're trying to figure out protocol and then also what how they're gonna
Supervisors, this is Brunel. Yes.
We had.
Yes, we did.
Flu shots here yesterday, I don't know if you guys
I don't think anybody's got a question for Ron.
No.
Nope. I drove the D59 yesterday. Drove really nice, so. Yeah.
hired Mike Frieden,
What's that?
secondary roads. He's
No, I went through them all.
early 30s, probably worked for Pearson Ross Construction for a long time.
Oh, no. I just
That's
stayed on the,
Yeah, lives inside. They used to work with them. Good.
yep.
Good construction.
Had to go around a couple barriers, but,
Don't miss it.
yeah, no, it was nice, so. Nope, I don't think we have any questions for you till next week, so, okay? Thanks, Ron.
That bill for Lakeview, lumber on that walking trail at Haiti Park, they used a lot of those new screws that have the big flathead. They used a lot of those. More than we,
So, do they have that project done then?
yeah. They might need a little more aggregate, but I haven't been stuff. I saw some pictures of it on the phone. Looks good.
Dawn, it slipped my mind to sign that document you
I
have it
have
today.
it, I picked it up.
Good, thank you. I thought of it this morning when I saw your name on the
Yeah.
agenda.
Not a problem.
make a motion to approve claims on the register for a total of $335,118.55.
I'll second that motion.
Motion been made and seconded to approve claims. All in favor, say aye.
Aye.
Aye. All ayes, motion carries. Forward, Don, if you want to.
I didn't know if I was 10
No,
or 10,
that's
15.
great.
So I just knew I was on around then.
We're in a hurry today, so.
Okay, I'll talk fast.
No, not for you, just to get the meeting done.
I met with the county board last Tuesday, and we were just discussing things, and I had some questions from people in attendance, and then Gary Nicholson asked a few questions, and as I'm speaking, Scott Jacobs picked up the phone. He said, "I'm sorry, Don, but I gotta cut you off." He said, "We've got a Pocahontas hearing on a dredge ditch or something." So if that happens today, just let me know.
We're good.
Okay.
You have all the time you need.
All right, well, I don't want to go over. Well, and it's, this is the summary that I have been going around to the local boards to, just provide a quarterly update. And I know that when I come out in July, you had mentioned that, you're keeping them all up to date. If I'm going out to the other counties, it's only fair that I don't exclude SAC. So, and this is an opportunity for you to ask any questions that you might have. And so I'm not going to go into a lot of detail, just give you kind of a general overview of what's happened over the last 3 months. I think we've really made some good strides overall. I think it's going very well. Obviously, with Cherokee County wanting to, come our way, I think that shows that the governance board has done a very good job of making sure that our region is operating as a region and really doing, what we need to do as far as the intent of the law. As far as administrative updates, as you know, BB County is now the fiscal agent, and it's been going very well. All of the provider service claims that used to be paid by the individual counties, it didn't take long for the providers to get on board and send all of those claims to BB County for processing. And I think the providers have actually appreciated the fact that they just have one bill for all of the people who send one place. So that has really streamlined the process. And I have been sending the claims listing out to the governance board every month for those to be reviewed, and haven't gotten any questions on claims so far.
Can I ask?
Sure.
So as far as the projected time that it was gonna take, and I know we're early in the process, how has BB felt about the time required to do this job as the fiscal agent?
Actually, I have not heard any feedback or complaints for our auditor's office. I did realize that we had not sent that fiscal agent fee to BB County, and I got a hold of our auditor a few weeks ago and wondered if she wanted to wait until December to have that paid, and she said, why don't we just process it now, and then we can always make adjustments if they feel that the amount we're paying as a region is too high. So that claim should have been in the claims listing, and if it's not, it would be paid next month.
But
so.
as far as projecting how much time it would take and what it's
I have
actually
not
taking-
gotten an update from them on
Okay.
that yet, no. But I will at budget time, definitely.
Okay.
We do have our liability insurance for the region. I did have some questions from local boards. In fact, when I met with the Carroll board, they were questioning the same thing that Rick did as far as shouldn't that reduce the county's liability with ICAP? And I had suggested Mark Beardmore, who had questioned that he get in touch with you, and I don't know if he's followed up with you, Rick, or not, but we are paying $7,000 for the year to ICAP for our coverage. And recently I met with one of our representatives, and we were discussing some of the concerns that I have as far as the transporting of clients in personal vehicles. And it was because of a situation with our mental health advocate, in which I think she put herself in a really serious situation. And it was recommended that we develop a policy as a region to prohibit staff from transporting clients in personal vehicles. This was brought up at our last governance board meeting last week, and we are kind of, we're moving in that direction. I need to follow up with our representative as far as actual coverage. If what we have purchased would cover all staff, including our advocate, who is really a contract employee per se, or, and according to our attorney, state employee, and that we should be released from liability, but I still need to check with them on that. So I think we're moving in the right direction there, but I think as far as making sure we have some kind of policy in place that prohibits serious situations, especially for our coordinators.
After thinking that over and after our discussion with our governance board, I feel we need some assurance from ICAP I think you could very safely argue that our direct employees are covered. I'm concerned about that.
Because she's technically a state employee and according to our attorney, yes.
And except that when you have the argument in court, they're gonna say you're paying 9% salary.
Right.
So, be sure that we have something concrete on that, because that one, after thinking that over,
I think it's a false test in some respects too.
okay.
As far as contracts, we were able to get all of the contracts in place towards the end of June, and we had some carryover contracts, and we're still waiting on a contract from St. Anthony Hospital. We have in our contracts the expectation that if there's any rate increase that's requested, that there has to be a justification for that. And for our service providers, such as the Howard Center, they were able to come up with their cost based on a financial and statistical report. And the hospital, their cost center is completely different than a local service provider. And when we requested from St. Anthony's some kind of information to justify a 4% rate increase, they sent us our cost report, which was 190 pages long, and we received it at 8 a.m. on Wednesday last week. Therefore, we did not think that we needed something that extensive. We requested that they get us something in writing. My concern with not having a contract in place with St. Anthony's is that we are out of compliance as a region. We are supposed to have a contract with an inpatient unit. So hopefully by our next meeting, if we in November, we have that justification. All of our regional plans have been completed. We had to add more information to the transition and annual service and budget plans. Those were sent back to the state and have been approved. Our management plan revisions were pretty extensive. We had 5 pages of a review analysis by DHS, and we had a lot of information we had to incorporate in. Some was, semantics as far as making changes to the language, and other things were more involved, such as including our evidence-based practices and making sure we have a plan to bring the enhanced core plus services into the region. In those revisions, they gave us 6 months to make those, and our plan was approved by the board and sent back to the states at the end of September. I did get a verbal authorization from DHS that our plan will be approved, but I haven't received anything yet. A Medicaid offset, Renell, you would have received a letter from DHS, and your offset for Sac County was pretty minimal, $1,971. So
I think I made a copy of that letter for you.
Yeah, I just looked at it.
That was, we were really happy with that.
very, very minimal, and that is so basically, it was an $850 for 6 month savings, and then they doubled it for the year, so you had a minimal amount. And you'll just have to reduce your levy in FY16 by a small portion. Yeah.
And that was something that kind of in the last hour, the state put in their code that we were gonna have to pay back a savings. And so everybody had fear that might be
A huge
something
amount.
big. And so we were really pleased that it was less than $2,000.
So we have to get that back. Do we have to amend?
Well, actually, we didn't get equalization money, and so if you got equalization money, you would have paid it back out of that. If you didn't get equalization money, we have to lower the levy by $2,000.
Going forward or
Going
back
forward.
For 16. 16.
15, 16.
15, 16, not, okay.
Right.
So we don't want to do
Right.
Yeah, and I need to, at some point in the next week or so, look at it as an aggregate, because when we do our budget, we need to, really see what the impact is gonna be overall, because Buena Vista Carroll's equalization, well, BB received equalization of $295,000, and so our offset was around $45,000 that has to go back. And then Carroll County, which, they already are providing 100% property tax relief because they're not levying this year. But if they were levying the full amount, they would have to reduce theirs by, I believe their offset was around $56,000. So it's really not gonna have an impact for Carroll, because I looked at them using their levy next year to use their fund balance. As far as services, our task forces have convened. We've met, the Calhoun County Task Force has met on a couple of occasions. Calhoun County was a task force designated because of lack of services in Calhoun County. People in need of mental health services had to either go to Carroll County to receive those services or Fair Hill Center. that they affiliated with in Webster County. And our advisory board really felt that it was imperative that we provide some services to equalize services across the region. Counseling services has opened up, well, actually not opened up, they are renting space for public health worker
Oh,
in Rockville
they
City.
did take that space.
Yes, and they should be up and running now. They were gonna start with 1 day a week, and it was Emily McNace from Counseling Services is going to be there. I believe they were gonna start on the 9th, actually, and it was gonna be every Thursday until they determine the need. And if the need is greater, they were going to look at expanding maybe more than 1 day a week. But we're starting off with 1 day, so that's great. And then we're also working with Plains Area Mental Health Center to provide some telepsych services within Stuart Memorial Hospital. So Patrick is going to be working with the hospital to get that set up. So anybody in need of psychiatric services, they can access that right in Lake City. And then our other task forces, peer and family support, those are services that were part of the initial core that we were lacking within our region. And we actually have, this is not going to be a very long-term task force because we have a consumer on our advisory board who's already taken the peer support specialist training. And she is very interested in assisting other consumers within the region with getting a training lined up. And she's going to be a vital part of that because she's already gone through it. And then
Who is that?
Karen Whiting, she's on our advisory board, she's from Crawford County.
Okay.
And then the family support, we are looking at working with NAMI. I've made some contacts, I'm just not getting a response back from NAMI on bringing in a family-to-family training program within our region. There was one offered at the end of September on the eastern side of the state, and we'd like to bring in the family-to-family training for the 6 counties so that anybody that's interested can take that training and be a family support specialist as well. Jail diversion and crisis stabilization, we had our first meeting at the beginning of September, and I think everybody just, it was more brainstorming sessions. We're really, in the initial phases of looking at this. Jail diversion, there are programs across the state, but they're done on a county-by-county basis. To do a jail diversion program in a 6 or 7 county region, I think is gonna take a lot more work and effort, and then to get buy-in from a magistrate. And I'm not sure how that's gonna work if someone is brought into the Sac County Jail and they have some mental health issues, and we wanna divert them from, if it's a simple misdemeanor and we don't want them to have to go back to jail or, to have that recidivism, how can we, work with, if we've got a magistrate out of BB County that's gonna cover that case in a jail diversion program. So we still have a lot of work there in education on our parts to be able to bring that service into the region. And then crisis stabilization, we are hoping to have something within the next year or so within our region that would be an option for people that don't meet that acute level of need in an inpatient setting and can just, if they have some mental health crisis, they can be seen in a crisis stabilization unit 3 to 5 day and return to their homes and keep those inpatient beds free across the state. I don't know if you mentioned some about the purchase of the van for IDA services.
I don't know.
Okay. IDA services in Battle Creek has had a long-standing issue with transportation. They were actually contracting the Siouxland Regional Transit System. We call them CERTs, it's easier. And they were paying $11.42 per trip per person. For 8 people, our bills were $2,500 a month. And that was an ongoing issue. I remember meeting with IDA Services probably in the spring of 2011 to try to come up with some other alternative. But when the region realized, we got together and we were looking at what it was going to cost us on a yearly basis, we were really in favor, and the governance board authorized the purchase of a van for IDA Services. So
We bought a used 14-passenger van and then turned it over to them.
Right.
It's now their responsibility, but then we won't be paying the cost of that transportation. So we pretty much, we really are going to recover the cost of that in 1 year's time.
yeah, we will.
So in
And
the future,
hopefully
it'll be a good deal.
it lasts
Yeah.
quite a while.
Yeah.
It only had 36,000
Yes.
miles on it, so.
As part of the arrangement, we put tires on it, and so it should be good for them for a long time, and we are then gonna avoid the $30,000 a year transportation cost. And the van is gonna be titled and owned, and their responsibility from that forward, so.
We also are working with the Iowa Coalition for Integrated Employment. There were 2 staff from that group that came out and did a full training with all of our vocational providers last Thursday in Storm Lake. Very well attended. We had 30+ people in a very small room. But really, trying to strategize ways to move away from segregated work activity centers and enhance employment opportunities for people in the community. And from that, after the meeting, there were a group of our vocational providers that wanted to get together. They were meeting separately to come up with some kind of a proposal for supported employment within our region. So I have not heard back from that group yet, but it consisted of the majority of the providers within our region. So I was curious to see what they come up with. Howard Center had requested the amended contract to add work skills back within their organization because it was cut, I don't know, how many years ago?
2 years ago.
The work skills.
And we're providing them in other counties, so it's not right to exclude them if others are being, so we did make that arrangement, and it's kind of it's the last effort, as far as they try and do other things, and then if they can't work something out in other categories, that's provided, and that's the last stop.
And, we did that, and with the understanding, and Pat Larson, their director, knew that we were doing this to be able to provide some work opportunities for the people that they serve and attract maybe some younger consumers to the agency, and then make it fair across the region as long as we're funding it at other providers. But she does know that the federal and state landscape is shifting away from segregated employment, so eventually, and she's on board with that and understands it. Another service that the region is paying for that's non-core is residential care facility services. And as of July 1st, 2014, we had 18 people that were in RCFs within and outside of the region, and 3 of those folks have moved into the community today. We also have 3 additional pending placements, and I have to give credit to Lisa Mayer, who's our coordinator for the SAC and Calhoun, as well as Louise, who covers the other 3 counties, because they are really working hard to find community placement options for these folks. And we are getting inundated the last couple of months with RCF requests. We've had a couple that have gone to the hospital in Sioux City, and the social worker is automatically calling for RCF placement. We're having the same thing with St. Anthony's.
So with that in mind, one of the presentations was that that's absolutely going to go away in 5 years. Have you heard any more about that?
I think there are providers that are writing it out, and they're just going to continue to do what they're doing. There are other providers that are diversifying services as a result of the RCF. There are RCFs that are being closed. Pride Group in Lamar's, they are adding some community homes where they can provide rehabilitation funding. And that's what we're looking for. When we get those costs for the RCF placement, we make it clear, 3 months, stabilization coming out of the hospital and then into the community. Be that in their own home with supports or into a rehabilitation home. Because yes, we know the reality is the RCFs are, in jeopardy because they're not considered community-based.
And he indicated 3 to 5 years, if that's still...
Yes, the target for DHS with their renewal of their HCBS program is 5 years, and that started in March of 2014. So they have a 5-year transition plan to move, make sure that every provider across the state is providing services in a community base. They have to meet certain standards, and it doesn't exclude RCFs. As far as our budget, the service expenditures to date, that's not a to-date figure, because this is the same presentation I've been giving to all the boards, and I had prepared paid claims today. But at the time that I prepared this presentation, it was $482,000, and we have budgeted $2.4 million. So essentially, that 482,000, you can't take that times 4 and think that that's what we're gonna spend this year, because 170,000 of that was the coordinator salaries and benefits that were paid back to those counties right at the beginning of the
Paid
year.
up front.
So the service expenditures, what I am projecting right now at status quo with no additional startup costs that would be requested for our enhanced core services is around 2 million for the year.
Is that what you expected?
And that's if we don't move anybody out of RCFs and out of work activity into community placements. Status quo, we're at 2 million probably. And then, the second contribution was to be paid to the region by the end of October. That was a decision the governance board made at our September meeting to stay on the quarterly payment cycle. And you've probably already processed your claim, I assume.
It was on the list today.
So then,
Yeah.
Yeah.
So, questions that you have, or me or Rick is totally capable of answering questions too. He's doing a very good job of carrying that board.
You are as well, and I think we're, I guess, and they know, we're very fortunate to have good administration, and
Thank
you
you.
do an excellent job. Our service coordinators are excellent. I feel really good about how things are going, and as you know, and really, I mean, I think we're on track to do what we need to do.
I think so, too.
have a smooth.
You
My
put
big-
a lot of work in.
Yeah.
It's been a lot of work. Look, huge time commitment on the part of the supervisors that are on that governance board. And I think my biggest struggle is going to be the development of these enhanced core services, because I need a clear path. I need to see exactly what this is going to look like. And I am not one that moves at a slow pace. I like to see progress and changes, and to think about a crisis stabilization a year out from now, that's probably realistic, but I would like to move quicker than that, but we want to do it right. I failed to mention that we are going to, on the 5th of November, to Dallas County, and there's a group of us that are going down to view their jail diversion program and talk with them about how they've structured it within their region. And then the next day will be in Appanus County, down in the southern tip of the state, because Appanus County, it's Wapello, Davis, and Appanus, they're a region. And they have just opened, as of April 1st, a crisis stabilization program, and I received their PowerPoint that they did with all the providers. Marked results in a short amount of time, how many people they've been able to divert out of inpatient. It was around 80% of the people that were in need of services were diverted out of inpatient. So,
We, our second judicial board of directors a couple of years ago went to a presentation in Story County.
yeah,
Okay.
they have a program.
They were doing it, and have been doing it for a while.
And I think, county, if you're doing it on a county level, it makes sense. You can get all the key players for your county together, but to do it on a region-wide basis, that's where I struggle a little bit to figure out how that would work when you're dealing with the legal system from county to county. If you have one magistrate designated for the region, making sure that you're within the confines and structure of what the legal system has to deal with.
So we could be dealing with anywhere from 7 to 10 different magistrates.
Ideally, I think to make it work, and this is just my view of how jail diversion should work, is that you're gonna deal with 1 or 2 for the entire region. That's where it could be.
Can you arrange that?
I don't know, and that's what we need to find out. So,
Because, I mean, if you've been charged in it,
yeah, exactly.
how do you move them?
When you're in a different, yeah.
Do you move the client or the magistrate?
Well, that's the question. So my initial perspective is that we may have to include all the players that you may not.
And then to get buy-in from that many magistrates, if we do it that way, county by county.
I think you're gonna have to, because I don't
Yeah.
think, I don't know if they, first off, would have the flexibility or could have the flexibility, because if you're charged in that county, I assume that would have to be
You're
seen.
under that jurisdiction,
I think so.
exactly.
Well, after a while, though, they might learn, once out of town, they could start a working relationship where they could.
Or specialize or something. Do you think they have
Well,
that
for example,
flexibility?
Warren is gone for a week, and Kenny's got somebody, and Warren's comfortable through communication, working with another magistrate, and, over
Yeah.
time, maybe it could evolve.
And
So will
Ken-
you have to go, I would assume that you'll have to go through the administrative part of the court system to try and get.
We'll have to involve them as well, yes. And I should mention, Ken did come to the diversion and crisis stabilization task forces in September, and yeah, he's very interested and had good input.
Good.
Because, you know, he sees it firsthand, it's on the ground, so, yeah, it was great to have him engaged in the process, and hopefully he continues to be a part of that, because we really need law enforcement involved.
Before it slips my mind, do we have an advisory board meeting
Thursday at 3.
Thursday at 3
Yes.
here inside?
Okay. Any other questions? Okay.
Thank you.
Yes,
Yeah,
and
done.
I'll be coming around again probably in January, and that'll be a good time to talk budget. Hopefully I'll have a good projection for the boards by then, so that you can determine on a local basis what you're going to do with your levy and
How are some of our neighbors getting along in neighboring districts or
regions.
regions?
You know, the only one that I really heard about lately is Sioux Rivers with Cherokee opting out and coming in. I think that with the difference in philosophies as far as how that is, you know, the region and the intent of the regionalization process, I think Cherokee is going to feel like they have a better match, and Sioux Rivers, the way they've structured things, I think overall they're gonna be more satisfied as well, just from what I've heard.
I had mentioned this morning that we have approved from the governance board their ability to join us, and that with the caveat that they have to work out all their financial concerns about Sioux Rivers region releasing their money or anything else that might happen, and so today we need to pass the resolution.
Yes, and Jan Hikas did call me Wednesday after the governance board met, and she had gotten a phone call from Shane wondering exactly what they needed to do to be legal about allowing Cherokee to come out, or to opt out, and she wanted to know from my perspective what I felt needed to be done, and I said, we really need some written assurances from Sioux Rivers. And she was gonna work with Shane, the CEO, to, you know, draft something with their county attorney that we have that guarantee that they're going to release the equalization monies to Cherokee, that they're not going to come in this next year, because that was a concern I had. They're still in a 2080 with, you know, Sioux Rivers, and then if we modify our 2080, they have a foot in both regions for the next, you know, 8 months. And is there a potential for scooping dollars from Cherokee County when they're supposed to be contributing their per capita to the region? So we need something, you know, written, and then they need to amend their 28E to allow Cherokee completely to move out.
With zero consequences.
Right.
And I.
So do you need that before you do this?
No.
No.
Okay.
This is just a resolution that you're allowing it, and that's the way our 2080 reads. You've already approved it, but then when we were looking at the terms of our 2080 agreement, it had to be done by resolution of the governance board, and then resolution by the local boards for the governance board.
In
to
our
take
previous
action.
conversations, I think, and I agree, we wanted them to have the assurance before they did their exclusion from Sioux Rivers that they would be approved here. And so we went back to our local boards and asked for, by motion, the ability to include them in our region. And when we went back to the 28E, the governance board needed to do it by resolution and then on to the local board of supervisors. So today I would make the motion to approve the resolution as provided here to include Cherokee in the Rolling Hills region.
I'll second that motion. Motion's made and seconded to Cherokee joining Rolling Hills. All in favor, say aye.
Heck, aye.
Stock eye.
Drake, aye. All ayes, motion carries.
That's the one from the governance board. Do we have a signing page for the local one as well? Or we need to create that?
Yeah, I had just sent the language to the auditors because I didn't know if you needed to put a resolution number on it, so
Yeah,
it
we
was just
will.
language.
Yeah.
Yeah, we can create that signing page too, just right at the bottom of that one, I suppose.
I think, otherwise, as far as the Cherokee, asking to join their size of county is similar, I think their philosophies are similar. Their financial condition was good and sound, and I think they're just a better fit here.
They house a state
They have something facility, so I think it'll be a good thing in the long term, and look forward to working with them. And as far as changing, they had to agree to operate under the conditions of our 2080 arrangements with no changes, and they were happy to do that.
And then also, the date that they're requesting to come in is January 1st instead of July 1st. And that's another thing that I had requested from Jan, because the 2080 reads that this takes effect June 30th under the termination clause. So I just want to make sure that there's not going to be any repercussions if we allow them to come in January 1st.
But in following paragraphs, we do have the ability to.
We can waive the date
Right.
in our 2080, but in the termination section, which is section 0.3, it does state that if they are to amend or dissolve their 2080, which would be dissolving their current, that it takes effect, the new one takes effect July 1st of the following year. So I just want to make sure that that's not going to be an issue for us.
As far as we had some discussion about, all of our 6 counties did the contribution of 4728, that's the plan. We had a lengthy conversation about what they had to come in with and if there would need to be startup costs, and we finally got that sorted out, and that coming midway, it would have been appropriate if they came in January that they would provide half of their 4728.
And any remaining of unspent.
And the consolidation of that was that they would agree to bring anything that was not spent. And currently, they haven't spent their 50%. So I think they will actually be adding a little bit extra, probably.
Well, and I guess with the startup costs that we've already incurred, I wasn't really looking at it that concretely,
I didn't
because to
either.
me, the dollars are blended, and so if Cherokee County brings in $400,000, we could say that $100,000 of that is designated to startup costs. When you're pulling those dollars,
That's-
and I wasn't following that.
I didn't either, and that's why I tried to
Yeah.
work through it, and because they wouldn't have been responsible to bring any more than their 4728 had they
As
started
we
in
all
July.
know.
Right, and so there were no additional startup costs to that other than our time, and so it's gonna be a good thing. They're gonna pay more, probably more than their initial share, and so I'm happy with that.
I think it'll work out well.
Thank you very much, Don, for all your work.
Thank you for your time.
Have a good day.
Thanks, Don.
All right, you too.
Renee?
There are a couple of, here's the drainage claims for this month. And I've got a couple of work orders. This one is just a sign, regular, the other one is 157. This is that property that you talked to me about a while back.
Oh, yeah.
Um,
Oh, down by
down
Carmen.
by
Yeah.
Carmen.
Okay.
They've gone down and taken a look at that, and they're originally, when Eric was in that one day and talked to us about, it's Derek Frank property, and he talked to us about, some sort of a pooling ground that the NRCS was
Yeah,
talking
they want to
about.
create a marsh down
Excuse me.
there on the Frank property.
This work order actually is part of that, but it's an 18-inch broken tile that they found in preparing to do this right here.
Okay.
So that's what this work order is.
It runs south and north into that pond they want to make.
And
But it's
that-
gotta work, you know, at this point.
For
it's
the
gotta
others
work,
to get served.
You know, for the people that are south of
Uh-huh.
it.
And there is, part of the bill that came from INS, is $485.90. And I've got to call into Eric. I wasn't here yesterday, so this morning was the only chance that I had to look at it. I'm not sure, the bill to INS, studying an RCS proposal, map preparation, I'm not sure that those are district
I don't think so
responsibilities,
either.
or if they would be part of this DNR and
I would
RCS.
think.
I think so too.
I understand, you know, the work order should be a district.
Oh, yeah.
But,
No, if I,
But
you know,
these
if I put
up
my
here-
land into a wetland, it's my responsibility.
To pay for the
I
preparation.
have not gotten a call back from him, but since we're only doing claims every, once a month.
We need to pull that
I
one.
guess I think, my opinion is that we should hold off on approving this one until we get more information from him.
Yeah, I mean, I totally agree, that's not our, that's part of the
I mean,
project
I think
cost.
that the work order should be, part of what we owe, but I don't know that, looking at the NRCS proposal and then proposed wetland development, in my mind, those should be part of their project costs.
Thanks for catching that,
Yeah.
'cause that's not something that the district should pay.
Well, and I apologize that I don't have an answer for you yet, but.
Marty Bauer's doing quite a few of these repairs, isn't he?
Well, you know, he's got one of the few that's bonded.
So you're okay if I hold
I
on to
would
this
like-
other claim?
I'll make a motion to pull that one to get more information.
I'll second that.
Motion's been made and seconded to hold the one claim. All in favor, say aye.
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 Do you need
Aye, all
this,
ayes,
Jim?
motion carries.
What's this one here?
That is,
Is it INF?
yeah,
Guess we got two
Brown.
returns.
How much was that for?
$485.90.
We got two returns. I'll make a motion to approve a tile repair.
Let's finish the thing. Or did you include those in your motion?
I should have.
Well, you can.
Okay, I'll make a motion to pull the one claim to INS and approve the balance of claims, drainage claims.
I'll second that motion.
Motion's been made and seconded to approve claims and hold the one claim. All in favor, say aye.
Aye.
Aye, all ayes, motion carries.
I'll make a motion to approve the proposed tile repair joint district 64 SAC 105 BB tile range 3, section 2, Delaware Township, Sac County, and the total estimate is $900.
I'll second that motion.
Motion's been made and seconded to approve the tile repair. All in favor, say aye.
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 Aye, all ayes, motion carries.
And then we have a second proposed tile repair of Drainage District 57, lateral 2B, section 14 of Iowa Township. Excavate and replace this section of 14-inch tile, cement joints, for a cost estimate of $450. Marty Mauer being the repair person.
I'll second that.
Motion's been made and seconded for tile repair. All in favor, say aye.
Aye.
Aye, all ayes, motion carries.
You sound like I do.
I was home yesterday. I
Sunday, I was a pile on my couch. Little medicine helps though.
Thanks, Renee.
Thank you.
I gave you your report from the engineer, he won't be here today, so.
I'll make a motion to close the meeting.
Second the motion?
Motion's been made, seconded to adjourn, all in favor, say aye.
Aye.
Aye. Motion carries.
Thank you, guys.